Welcome back to my channel. There's one famous quote in pharmacology: one does not simply study pharmacology in a day. Each day we learn a part of it and slowly we build up. So, in today's video, I will be taking up receptor regulation part 2. So, earlier I have made a receptor regulation part 1. I have covered receptor desensitization in that, in down regulation of the receptor. So if you haven't watched my previous video, you can click the link given in the description box. So today's lecture, I will be covering up the upregulation of the receptor. As the upregulation of the receptor, the word itself says up means there is something which is increased. Now what is increase here? There is increase in the number of receptor, and subsequently the sensitivity of the receptor, that is also increased. Now these two, they are the important theory question, and as such receptor regulation, when it is asked, students, they are supposed to write all the points. Sometimes they ask about down regulation and up regulation of the receptor. They are very commonly asked in YOC. I'll just explain it by giving one example. Suppose you are busy in some cultural event, college cultural event, or in any of the function, you are organizing something and you were busy in organizing that, and full 1 month you were busy. Now you are totally exhausted, right? And you are not able to do anything after that. You take some rest of 1 week, you go to hill station, and again you are charged, again you are ready to do all that, right? So when you are doing a work, same concept I will explain here with the in term of down regulation and up regulation of the receptor. I'll take here the down regulation of the receptor. So what is that down regulation of the receptor? There is decrease in the number of receptor, right? When this thing happens, the example which I quote, when you are going to make the receptor work, and when the receptor will work, when we are going to give the agonistic drug, right? Now receptor, they have to work, and there will be down regulation of the receptor or decrease in the number of receptor. Now the second one is up regulation of the receptor. When there is up regulation of the receptor, when the receptor, they are going to take the rest. When they are going to take the rest, whenever we are giving antagonistic drug. Now the receptor, they are not working, so what will happen? There will be up regulation of the receptor. That means there is increase in the number of receptor. So this already I have covered. This I will be taking today. So antagonistic drug, either you give this or you are going to deprive the receptor from the agonistic drug. So I'll take up the example of antagonistic drug. Suppose you are giving a beta blocker to a patient of angina. For a long time you are giving a beta blocker to a patient of angina, and all of a sudden if you withdraw it, then what will happen? If you withdraw it suddenly. So to explain it in detail, just say the normal thing. The beta 1 receptor, they are present in the heart, and if you are giving the agonistic drug, then what will be the effect? Beta agonist drug, or if there is some endogenous stimulation of this receptor, right? So this is a beta 1 receptor. Either you give a agonistic drug or some endogenous stimulation of the beta 1 receptor. Now endogenous Again, heart, it is under the influence of autonomic nervous system, both sympathetic as well as parasympathetic. So sympathetic is, here I have drawn the sympathetic, that is the thoracolumbar, and parasympathetic nervous system, that is vagus nerve, craniosacral. So sympathetic nervous system, by releasing this noradrenaline, it is going to act on beta 1 receptor. So what will happen if the stimulation of the beta 1 receptor, there is increase in heart rate, increase in cardiac output, increase in the, sorry, before that, increase in the stroke volume, and ultimately there may be a rise in blood pressure. So whether we are giving a agonistic drug or there is a stimulation of this sympathetic nervous system, so this thing will happen. So from the thoracolumbar, it is a norepinephrine or noradrenaline will be released, whereas from the adrenal medulla, so this is the cortex, I am talking about the medulla part, this part is the adrenal cortex and this is the medulla, and from the medulla both these norepinephrine and epinephrine, they will be released. They are going to bind on the beta 1 receptor, both of them, and ultimately they are going to exert this effect. So this is the effect of stimulating the beta 1 receptor on the heart. Now the patient is taking beta blocker. We are talking about the beta blocker, we are not talking about the beta 1 agonistic drug. So what will happen if you are going to put the patient on beta blocker, right? Now if you are going to give a beta blocker to the patient, the effect will be just opposite. There will be decrease in heart rate, decrease in stroke volume, decrease in cardiac output, and decrease in the blood pressure. You are giving as an antihypertensive, suppose, then it is going to decrease the blood pressure. If you are giving it for the angina, it is going to decrease the workload of the heart, then also it is going to help. Now is it all the effect they are due to beta blocker? No, the effect is not because of the beta blocker. The effect is because heart, it is under the influence of two systems, sympathetic as well as a parasympathetic. Now if you are giving a beta blocker, what will happen? This beta blocker, they are going to block these receptor. They are going to bind with the receptor. They do not exert this effect. They do not allow the catecholamines, endogenous catecholamines, to bind here and show the effect. So what will happen if you are giving a beta blocker? Now the catecholamines, they cannot bind. Which system will predominate now? Parasympathetic or vagus. Vagus is going to take over this, and all these effects, they are because of the vagus. They are not because of this. The effect, we are giving a beta blocker, they show this effect, but the mechanism is, it is a vagus, parasympathetic nervous system, they take over the sympathetic nervous system, and the fact is this. Now if we suddenly withdraw this beta blocker, then what will happen? Suppose I have withdrawn the beta blocker, but patient was taking a beta blocker for a long time. The patient was taking the antagonistic drug. Now what happens in the heart? There is upregulation of the beta receptor. There is increased proliferation of the beta receptor, and they are super duper sensitive. Now I have withdrawn all of a sudden. Now what happens? The receptor, earlier they were masked by what? By the beta blocker. So these catecholamines, they were not getting a place to bind with the receptor. Now you have withdrawn this. आप अब ये नहीं दे रहे हो. Now what will happen to beta receptor? The catecholamines, it will go and bind to this newly proliferated receptor, and what will happen? There is increase in a heart rate, huge rise in heart rate, tachycardia will be there, increased stroke volume, increased cardiac output, and if the person with the hypertension patient is taken, there's too much rise in the blood pressure will be there. If anginal patient is taking this beta blocker and withdraw all of sudden, then what will happen? Patient may go for unstable angina. Patient को ये भी हो सकता है, right? Now, what is the clinical relevance of this? The clinical relevance of this is we should not withdraw the beta blocker all of a sudden. It should be withdrawn gradually. Now, what are the other causes of upregulation of the receptor? The other causes of upregulation of the receptors are even few hormones. They can also cause the upregulation, and the most important is in thyrotoxicosis, the thyroid hormone, they are going to cause the upregulation of the beta 1 receptor, and there is increase in the number as well as sensitivity of the receptor to the endogenous catecholamines, and this leads to the tachycardia. Another important cause is by the denervation supersensitivity of the receptor, and the example is tardive dyskinesia after the prolonged use of neuroleptic drug. This is a drug which we use for the treatment of psychosis or antipsychotic drug. This is the late side effect which is seen with the antipsychotic drug. What will happen here? Tardive is late. Dyskinesia is it is a involuntary movement. So here patient comes with the orobuccal lingual motion. So it seems as if patient is chewing the gum. Now what is the cause of this? Because now the patient is taking a long-term neuroleptic drug for a long time. Because of the prolonged dopamine receptor blockade, now what will happen? The striatal nerve, they start synthesizing new dopamine receptor, and this dopamine receptor, they are super sensitive to dopamine, that small amount of the dopamine which is still coming from the neuron despite the blockade. Now this super sensitive dopaminergic response, it is going to outweigh the cholinergic response, because we know in the neuron there is a balance between dopamine and acetylcholine. Now this excessive dopaminergic response, that is the reason for tardive dyskinesia. So this is another example of the upregulation of the receptor. You are given the blockade or antagonistic drug. Now what will happen? The new dopamine receptor, they are synthesized. This is upregulation of the receptor, and they are super sensitive to the dopamine, and what will happen? This leads to tardive dyskinesia. Now question answer round. The first question: when a drug binds to a receptor and causes action opposite that of agonist, this is called as, the first key is complete agonist. So there is no as such difference between the agonist and a complete agonist. So both are one and same thing. Partial agonist, this has got both the agonistic as well as antagonistic action. So this is also not a right choice. Antagonistic, they do not show any effect. So what is left? Inverse. Inverse is just opposite. So right choice is, it is a C. Now another question is, if a patient on a long-term beta blocker therapy undergoes a surgery, when he has to stop the beta blocker? One day before the surgery, on the day of the surgery, after the surgery, or should continue? So here again a long term. Patient is taking for a long time. Should not withdraw beta blocker at any time. Big no. Should continue with this. So right choice is this. So next question is, explain why abrupt withdrawal of long-term beta blocker therapy in patient with angina may be associated with unstable angina and myocardial infarction. So here reason is, as the antagonistic drug, or here is the beta blocker, it causes the upregulation of the beta 1 receptor. So when we are going to withdraw beta blocker, all of a sudden what will happen, these receptors they get unmasked. So natural catecholamines, they are going to bind with the receptor, that results in the increased heart rate. When there is increased heart rate, then that is going to increase the myocardial oxygen demand, resulting in unstable angina and myocardial infarction. So if you like my topic, kindly like and subscribe my channel. Thank you.